You think grief only shows up at funerals. But there's a kind of grief with no casket, no tears, and no one who knows you're going through it. People living with chronic pain grieve every single day. They just no one ever tells them that. We tend to think of grief as losing a person. Losing a parent, a partner, someone you love deeply. And that's true. But researchers have found that grief, at its core, is really about losing possibility. The possibilities woven into your habits, your plans, your sense of who you are. Think about what chronic pain actually takes from you. The work you used to do without thinking. The future you imagine for yourself. The version of you that could move freely, without having to plan every single step in advance. According to a study published in the journal Medicine, Healthcare and Philosophy, chronic pain isn't just a physical experience, it profoundly disrupts a person's practical identity. Who you believe you are. Who you thought you could become. That is exactly what grief is. But here's the critical twist. Most people living with chronic pain, and most people around them, never recognize it as grief. Researchers have identified at least 4 cognitive barriers that get in the way. First, we've tied grief so tightly to death that it simply doesn't occur to us that pain can trigger it. Second, chronic pain is invisible. No visible wound means no visible loss. Third, conventional grief has a rough beginning and end, while chronic pain is fluid and recurring, so it doesn't fit the shape people expect grief to take. The fourth barrier is the most dangerous. People frequently misread what chronic pain patients are experiencing as depression rather than grief. They sound similar, but researchers are clear that they are fundamentally different experiences that require fundamentally different responses. Treating grief like depression isn't just ineffective. It can actually push someone toward real clinical depression. Grief needs to be seen, acknowledged, and allowed to exist. Depression calls for an entirely different kind of intervention. Confusing the two comes at a serious cost. So hold on to this. Grief doesn't only belong to funerals. It also belongs to people who have lost the life they used to have. And that loss deserves to be taken just as seriously.